Good afternoon to one and all present here. I have the distinct honor of inviting our distinguished session chairs, Dr. Ghazala Javed and Dr. Nigat Anjum. Dr. Ghazala Javed is Assistant Director at Center Council for Research in Unani Medicine, Ministry of Ayush, Government of India, where she oversees technical operations and contributes to planning, implementation, and monitoring of research in Unani medicine, including drugs, standardization, quality control, and fundamental research. Dr. Javed also holds a PhD diploma in intellectual property rights and WHO fellowship in public health program management. She has authored or co-authored around 90 research papers, participated in more than 200 scientific platforms, and reviewed or edited 20 books. She worked extensively on international cooperation, engaging with WHO, WIPO, UNESCO, and she received several honors, including the Make in India Award, NCR Delhi Dr. Abdul Razak Award, and the Dr. Sarojini Naidu International Award for Working Women. And our next session chair, Dr. Nigat Anjum. She is an esteemed research officer in the Unani division at the Center Council for Research in Unani Medicine, New Delhi. Dr. Anjum brings deep domain expertise in Unani classical formulation, clinical research, and regulatory sciences. Over the years, she has contributed significantly to the Unani knowledge base, having co authored research on traditional therapies, pharmacognosy, and patent dropout dynamics Unani clinical programs. She also played key role in research and public outreach. Dr. Anjuman hold a strong academic and research profile documented on her Google Scholar page and has been actively engaged in advancing the modern scientific understanding of Unani medicine. We welcome you, ma'am, both of you. Thank you. And
I welcome all of you to this session. Straight away, as I think we are already a little beyond schedule, so I'll straight away request Dr. Ghazala Javed to present her talk.
same.
She will be apprising us on um, Unani medicine in mainstream healthcare, the current scenario.
Full screen. Yeah, just click on this. Thank you. A very good afternoon to everyone. So, I really thank our respected Director General, Dr. N. Zahir Ahmed, who could not be here for nominating us for this symposium. And I also thank the organizers for providing this opportunity. My main aim is to set the tone for discussions and give you an insight in what Ayush and specifically Unani medicine is and what our research council is doing in this. So I'm sure most of you know about Ayush. The young crowd sitting over there, have you heard about Ayush? It is an acronym for Ayurveda, Yoga, and Naturopathy, Siddha and Sovarigpa and Homeopathy. And recently it has been adopted as a word. in the Commission for Scientific and Technical Terminology. So this system has got social and political push since the beginning. Father of nation Mahatma Gandhi, he was a staunch believer of indigenous system of medicine. And today, if we see the scenario, you can see the Ayush market growing from USD 2.85 billion in 2014 to 2023. So it started as a department of Indian System of Medicine in 1995, and then it was renamed as Department of Ayush and elevated as a dedicated ministry in 2014 to give a focused approach to these systems. So the objective of Ayush is to promote the traditional and indigenous system of medicines, and it is involved in policy formulation, regulatory framework, scientific validation, conducting awareness campaigns, and educational programs. This is a snapshot of strength of Ayush, where you can see the number for Ayush colleges having adequate number of UG seats and PG seats, Ayush hospitals and Ayush dispensary, just to give you an insight that we are there and the strong infrastructure is there. And out of this, if you'll see the strength of Unani medicine in India, so as the latest report in 2023, you can see we have 267 hospitals with 4,036 bed strength. Education infrastructure is also strong. We have colleges offering UGs and PG and also PhD programs. So today we can proudly say that India is world leader in Unani system of medicine. So basically, if it is new for you, what is Unani medicine? It is a science of which we learn the various states of body in health, and when not in health, and the means by which health is likely to be lost, and when lost is likely to be restored. The main focus is on the preservation and promotion of health and prevention of diseases. So since 8th century, it is flourishing in India, and as you can see, Hippocrates is the father of Unani medicine. These are our concept and principles. As I just mentioned, main focus is on preservation and promotion of health, prevention of diseases, and our diagnosis is based on the mizaj of a person, temperament. Normally, we usually ask, "आपका मिजाज कैसा है?" It's different than that. So every human being has a particular temperament which we analyze, and accordingly we advise the prophylactic and preventive measures. So then we also focus on hereditary condition, environmental conditions, different complaints, external observation. The nubs holds a lot of importance. Pulse examination, urine and stool examination. These are the various modes of treatment. The starting from dietotherapy, pharmacotherapy, we call it ilaj bil ghiza, ilaj bil dawa, Ilaj with Tadbir, where various regimens are advised. And in Ilaj with Dawa, main focus of treating a condition is through single drugs. And then we go to compound drugs if the disease is not managed with single drugs. Then minor surgeries we are doing. This is the organization from where we are coming. Me and my colleagues over here will be talking in these sessions. This is Central Council for Research in Unani Medicine. It is the research council under Ministry of Ayush, and all the research councils, whether it in Ayurveda, Yoga and Naturopathy, Homeopathy, they're housed in this building. Our network of peripheral institutes is spread pan India. As you can see, we have network of 24 peripheral institutes, a dedicated National Research Institute from Hyderabad. Two of our officers are from there, Dr. Gulam and Dr. Rooj. They'll be making their presentation. Then a Central Research Institute in Lucknow. So, like they're different levels, and a dedicated institute to look at the classical literature. And it is the backbone of this system. This is a snapshot of our peripheral institutes, just to give an idea, the strong infrastructure and government support which we get, and like in Mumbai, Aligarh, Srinagar. So the main objective of our research council is to formulate the aims and patterns of research on scientific life
in Unani medicine, and we take undertake research and other related programs, and then prosecution and assistant in research and propagation of knowledge. These are the research programs which are run by different program officers: preclinical and clinical research, fundamental research, focusing on validating the fundamental aspect of the system, drug standardization, focusing on developing monographs and pharmacopoeial standards, survey and cultivation of medicinal plants. As medicinal plant is the backbone of the system, so our institutes are involved in conducting surveys, collecting folklore knowledge, and cultivating for conservation and sustainable use of medicinal plants. Literary research program, of course, the classical text which is there for this traditional medicine, and creating awareness through various means of IC activities. So, just to give you a snapshot of major initiatives of CCRU, we are adopting the best practices. Our institutes, hospitals are NABH accredited, and laboratories, medical and drugs testing are NABL accredited. So, these are the bodies working under Quality Council of India, and our pharmacies are GMP certified, and one pharmacy is DTL. So, and the Center of Excellence is established in regimen therapy at Srinagar. So, to bring in standards in our practices, cupping, you all might be aware, we call it hijama. We have developed these standard operating procedures as we observe that this is practiced at various level in international and national platforms to give uniformity and to assist the regulators and provide practitioners the proper guidelines. We have launched this, and here you can see our Secretary Ayush and Advisor Unani, along with our Director General, Dr. N. Zahir Ahmed, launching this book, which is freely downloadable from our website. Similarly, we had brought out standard treatment guidelines. Musculoskeletal disorder is one of our strength areas. For traditional medicines, we are focusing on this. So we had published it through the Ayush vertical in Directorate General of Health Services, which is under Ministry of Health and Family Welfare. Same, you can see, we have launched, our council officers have worked in the development of these guidelines for management of metabolic disorders. These have been also been published by Directorate General of Health Services, Ayush Vertical. The standard Unani treatment guidelines for common diseases. It contains a list of 130 diseases, and we have also developed an app for that. So there is a Ayush vertical in Bureau of Indian Standards also. With these examples, you will see that how integration is a buzzword, and we are all moving toward that. Whether it is establishment of Ayush vertical under DGHS in Ministry of Health and Family Welfare, or Ayush vertical in Bureau of Indian Standards. So where we are developing standards for single drugs, terminologies, and for cupping also. So, our team has also worked in development of orientation guidelines for community health officers under Unani stream. So, this helps in mainstreaming healthcare in a proper way, and these guidelines focus more on early intervention based on Unani principle and practices. And this book we have listed how PHC, like primary health centers, secondary health centers, and district health centers community health centers and district health centers should function. So those guidelines are there of different level for mainstreaming. We bring out two journals. One is Hippocratic Journal of Unani Medicine and Jahanetim in Urdu language, because most of the text of this system is in Urdu and Persian language. So earlier, now, when the UGC care list was there in WO, at that time our journals were listed in UGC care list. So this is our research policy where we have laid down the priorities areas which we undertake. So as we get many collaborative projects from reputed institutes, so and from Chandigarh also. So I would like you to have a look at this document, which is freely downloadable. And our officer over here, Dr. Nikhat Anjum, she looks after intramural research programs, and Dr. Ritu Kawasra on collaborative expression of interest programs, where we invite proposals and that are scrutinized on the priority areas. So this is freely downloadable. You can have a look at that. We give support also, financial support. So these are our priority areas of research, whether it is autoimmune diseases, lifestyle disorders, viral infection, adjuvant therapies, diseases originating due to radiation and environmental pollution effects. So we invite proposal on these priority areas for research in both mode, expression of interest scheme, collaborative projects, and intramural research schemes. So we have also published training module for geriatric healthcare and manual on geriatric healthcare in Unani medicine. This document is also freely downloadable from our website, where we have laid down different modules how to conduct training programs for when you have to provide geriatric healthcare in this system. So Ministry of Ayush is also closely working with the World Health Organization, and our research officers are actively involved when we are finalizing the documents. The WHO has published benchmarks for training in Unani medicine to assist member states and countries if they want to do some training program in this system. And if they want to establish practice in Unani medicine, then WHO has also published benchmarks for practice in Unani medicine. We also have benchmarks for international Unani terminology, and where the definitions of these Unani terms have been standardized and published. And Unani mobility codes, along with other Ayush system, have been included in ICD-11 ISU Traditional Medicine 2 chapter. And WHO representation in conferences, like our officers go there in the meeting and they also come and participate in our conferences. So as you can see, this was a watershed moment when Honorable PM has inaugurated WHO Global Center for Traditional Medicine at Jamnagar. And these are the snapshot of the documents which are freely downloadable from WHO websites in Unani medicine. So we sign memorandum of understanding with premium institutes for fostering collaboration with partners, whether it is a CSIR institutes like CCMB Hyderabad, NIPER Hyderabad, ICMR institutes, and some reputed universities. And now we are having an active dialogue with Punjab University also, and we are hopeful that we'll be able to take it to next level. So internationally, we have signed MOU with Iran, Tajikistan, Bangladesh. So we do sign institute MOU, and we also establish Unani chair in any university or organization when we receive requests from these international bodies. So after all the formalities and political clearance, we sign these MOUs. So we have been granted 19 patents, and few patents applications are under process. So like, because these are based on traditional knowledge, we have to take approval from National Biodiversity Authority also. So our two premium institute, one in Hyderabad and one in Srinagar, are actively involved not only in research but have ventured in education also, and they are offering PG programs in medicine and pharmacology. And now, very soon, we'll be starting PhD programs also. So, pharmacovigilance initiative taken by efforts done by Ministry of Ayush, and we have a dedicated National Pharmacovigilance Center, and CCRUM, along with its peripheral institutes, are actively contributing on this initiative. So now Ayush sector is included in insurance coverage also for all this system. We have assisted in developing insurance SDGs guidelines for insurance sector also. So for e-Aushadhi portal, where the product approvals of Ayush are given, and for medicinal plants, we have a dedicated National Medicinal Plant Board, which is a statutory body under Ministry of Ayush, which is involved in conservation and sustainable use of medicinal plants. So from digital angle, we have developed 5 applications. This is for the use of general public, Unani professionals or Ayush professionals. One is you can know your temperament by clicking on this link. You'll come to know what is your temperament and you'll get a advice accordingly. I'll request all of you to go through this link and assess your temperament. Then we have developed an app on common remedies in Unani medicine. This is also a click away. This is for general public, where you can see the items which you use in your kitchen or generally freely available, how you can use them as common remedies to treat some common ailments. Then there's an app on single Unani drugs listing their uses, formulations, and Unani treatment guidelines. So this is one of the strength area of this system. We called it as regimenal therapy. I have listed some example. Our peripheral institutes are engaged in running dedicated OPDs on regimenal therapy, where these procedures are given: cupping therapy, venesection, leech therapy, massage therapy, steam bath, diaphoresis. These pictures are from our peripheral institutes only, mainly from Chennai, Hyderabad, and Srinagar. So, dietotherapy, you might have heard about Ayush Ahar. We have ventured into Unani Ahar, where we have launched preparations like Gulkand, Halwa Ghee Kawar, Harira, Murabba Amla, and Unani Kahwa, which has got very good feedback. And these are displayed during various Arogyas and trade fairs. Now also in India International Trade Fair in Pragati Maidan, all these items are displayed and we get a good feedback. Then in the last Unani Day, which we celebrate on 11th February, we have launched this easy to use Talvina instant dalia, especially for elderly. Talvina cookies, main ingredient is barley in this, and Talvina flakes in 2 flavors, lychee and cardamom and chocolate flavor, so that to lure the children that they can have it a healthy snack in the morning. So this kind of support and patronage we get. In the last Unani Day, Honorable President of India was there to inaugurate our event, where we created a history when Madam has come, and it was a great encouragement for all of us. So now coming to integrative medicine and key to mainstreaming, we all know that it is a buzzword, and it has been defined as interdisciplinary and evidence-based approach to health and well-being by using a combination of biomedical and traditional complementary medical knowledge. We have a dedicated national health policy which champions the concept of integrative medicine by advocating the mainstreaming of Ayush. So we have got the policy supports for integrating these services into national health programs. So here, if you'll see, we have these kind of mechanism when we are talking about integration. It is physical integration, where the facilities health services delivery network of the country. Is functional integration for achieving national health goals. Education integration by inclusion of modern medicine components in Unani course curricula. Clinical practice integration. So we have dedicated centers in tertiary care, allopathic hospital. Research integration, where interdisciplinary and collaborative research where integrative protocols is undertaken, and then standard setting integration for quality assurance in products by using modern technical tools. So this is one example where we had adopted one district for carrying out this national program for prevention and control of cancer, diabetes, cardiovascular diseases, and stroke, and where health promotion and patient management services was carried out and given along with the training in yoga. Here you can see we have a dedicated Unani medical centers at Dr. Ramanoloya Hospital, Deen Dayal Upadhyaya, Safdarjung Hospital. These centers are managed by council, and the patients are referred from allopathic side to us and from our side to allopathic OPDs also. This is also one example of integration in clinical practice. In collaborative research, I just mentioned we invite proposal, and then I'll just go through this. There's a proper mechanism where, like, we get proposal from these reputed institutes. So now, when we are talking of integrative research or integration in mainstream healthcare, so we really felt, do we need addendum to already existing ethical guidelines or the regulatory provisions? So there was brainstorming sessions, and then it was felt as integrative medicine involves a multimodal approach where IU systems are integrated alongside modern conventional medicine to enhance patient care and improve health outcomes. So it was felt that ethical and regulatory clarity is essential to ensure the credibility, safety, and efficacy to integrative approaches. So ICMR along with Ayush took this initiative, and this addendum was drafted, which aim was to guide researchers, institutions, and ethics committee and regulatory bodies involved in integrative medicine research. So this is also freely downloadable. It is an addition to the already existing 2017 guidelines, specifically addressing the when you are conducting research in IU system, traditional medicine in India, then you have to follow these guidelines. So what is it basically saying? So when an ethic committee is considering these kind of integrative research, two IU's subject matter experts with at least one being external to the institution, ensuring well-rounded and informed deliberation should be there. And they also tweak the informed consent standards. And all these should align with the regulatory national regulatory provisions. So now when you are working on a collaborative project with Ayush system and you're looking for Ayush related invention, so it was felt that sometimes these Ayush related inventions they do not get patents and the patents are rejected. So to assess the scientist, these guidelines have been launched, which you can go through, and it uh, very meticulously list and explain 6 guiding principles for assessing patent applications related to Ayush interventions. So, where if you're making claim for extracts, alkaloids, or isolated active ingredients of plants that are naturally present and known in prior art, it cannot be considered novel or inventive. However, processes for obtaining such extracts alloys may be patentable. Similarly, there are combinations of known ingredients, or if an ingredient is already known for treating a disease. So I'll request all of you to just download these guidelines and you'll come to know what is patentable and what is not. Same. So for these, for they have listed for invention related to equipment or devices also. So basically, you have to fill the criteria for novelty, inventive step, and industrial applicability. But there's a very fine line when you're talking about traditional knowledge or prior art, which is already listed in our classical text. I see the young crowd now gathering after lunch. I welcome you all. So now we have heard a lot about AI also, artificial intelligence. So these are being strengthened now by advanced technologies to provide cutting edge technologies to deliver more safe, personalized, effective, and accessible care. For this, again, WHO prepared a technical brief on mapping the application of artificial intelligence in traditional medicine. So this was launched under the global initiative, and it offers a roadmap harnessing this potential responsibility while safeguarding cultural heritage and data sovereignty. This is the technical brief which can be downloaded. It gives an insight into the rapidly evolving AI for health and landscape, how it might be utilized in TM, or what are the ethical issues which might pop up. This is the scope of AI and traditional medicine, where we talk about data analysis and pattern recognition. AI can help us when we are talking about misage analysis or temperament analysis. AI can help us. It can also help in drug discovery and herb analysis, preservation of our classical heritage, and assist in telemedicine accessibility also. So here I just want to say that the key takeaway that these systems offer safe, natural, and holistic strategies. And by addressing both physiological and psychological dimensions, it can be a sustainable model for promoting health and well being. And research in integrative medicine can further provide evidence based data for health and well being. And ethical and regulatory clarity is essential to ensure the credibility. As I just mentioned, an addendum is in place, which is freely downloadable. And traditional health logic is it's a dynamic process. Like you can add to this knowledge. This can give you positive leads to address many health challenges, and those leads can be added to these knowledge because these are processes dynamic in nature. So these systems are well established in India and further undergoing state of the art research, resulting in new products and processes. So these intend to provide clarity to the filing and processing of patent application, as I just mentioned, because we get many queries that we were doing this research, but when we had gone to apply for patent, it was told that it is prior art. So those guidelines are available. Please go through that, and that will be very helpful. Thank you so much. This was just to set the tone what Ayush system is and what is our strength area. Now my colleagues from Hyderabad and headquarter, they will highlight how we can integrate this system. Thanks a lot. Thanks to those claps also, which I'm getting from this crowd. Thanks.
Uh, Thank you, Dr. Ghazala. I hope, as you already mentioned, that this